Welcome to the latest episode of the Caucus Corner. Each week, we bring legislators and New Yorkers together to discuss some of the most pressing issues from the perspective of people of color. I am your host, Assemblywoman Micael Salage, chair of the Black, Puerto Rican, Hispanic, and Asian Legislative Caucus. This week, we are bringing something that New Yorkers are largely unaware of: the dangers posed by unvented gas appliances. While New York State met this challenge by requiring the labeling of unvented gas heaters, there are also critical public health concerns to address that require the labeling of gas stoves. The compelling need for labeling of stoves, combined with the undertaking of a broad public education campaign about its health impacts, was highlighted in a 2023 letter from 10 state attorney generals, including our great Attorney General, Letitia James, and New York City Corporation Counsel, calling for gas stove labeling. So let's jump right into the discussion on this important bill. We have a great advocate who, I know this gentleman long before we decided to work together on this bill, but he is someone who, is all in for climate. So Tim, I just want to give you a second to introduce you to our listeners.
Thank you so much. I'm so kind of honored to be here. My name's Tim Guinea. I'm the legislative director for former Vice President Al Gore's Climate Reality Project Chapter Coalition in New York State. And I serve on a bunch of other environmental boards as well. And I'm just thrilled to be here.
We appreciate you. And so let's begin this conversation by giving our listeners the basic surrounding of this bill, because I feel like this discussion has been so politicized over the past 5 years. So What exactly does this bill do?
Thank you. So what the bill does is it, as you mentioned, it recognizes the fact that Americans are largely completely unaware, according to studies, Americans are completely unaware that all gas stoves emit 4 combustion byproducts that are really dangerous to human health. And all the bill would do is require warning labels on new gas stoves to educate the public, to create informed consumer choice. It's, in my opinion, a kind of moral opportunity for the legislature to lift up public education. What the bill does not do at all is ban gas stoves or tell anybody what to buy or not to buy. I think that's the politicization that you mentioned earlier, is the notion that some boogeyman is coming to take away your gas stove. Nobody's coming to take away your choice. What we want to make sure is that people have the knowledge they need to make informed choice. If I could, I'd just like to talk about what those 4 combustion byproducts are that every single gas stove is putting out. The first is benzene. Benzene is a cancer-causing, it's carcinogenic. It is so toxic that the World Health Organization recognizes no allowable exposure to it. Formaldehyde, which the EPA also recognizes as a carcinogen through the pathway of inhalation. There was a recent ProPublica article that was done that suggests that the EPA actually undervalues the carcinogenic quality of formaldehyde by 4 times. Carbon monoxide, which kills about 1,200 people in the U.S. annually, hospitalizes about 100,000 people. We unfortunately just saw 8 people hospitalized in Syracuse, and a man perished from carbon monoxide there. And lastly, nitrogen dioxide. And nitrogen dioxide is something that is absolutely, definitely an exacerbant to asthma, and many studies believe is causal to the formation of pediatric asthma. In fact, one 2023 study suggests that nitrogen dioxide from gas stoves is responsible for 18.8% of childhood asthma in New York State. So about 1 out of every 5 cases of childhood asthma, according to that study, are from gas stoves. Stanford University says that About 19,000 Americans die every single year because of gas stove emissions. Jaime University in Spain suggests 38,900 people in the European Union and Great Britain die annually because of gas stove emissions. Now, that last study that I mentioned is in the peer review process right now. It's not peer reviewed at the time we're speaking. However, if that number holds, that means more people are dying from gas stove emissions in the European Union than in car accidents. So this is a big deal that the public really, really should know about, has a right to know about. And I am so thankful, Assembly Member, to you and to Senator Krueger for working so hard on bringing light to this situation.
And the statistics that you mentioned really tell a story, not just a general story, but if you drill down, Black Americans, adults, are twice as likely to die of asthma as white Americans, and Black children are 10 times as likely to die from asthma as white children. And so when you talk about this disparity, it's an impact on our communities, and we are more likely to live in communities and buildings and even houses that lack proper ventilation.
Right.
So this, we talk about these statistics. This bill would improve at least the ability for people to be educated on the fact that this problem exists.
Right. And just to widen the scope of our understanding about the profound influence on people of color, Hispanic adults are there are more cases of current asthma in Hispanic adults than anyone else in New York City. Indigenous Americans incur about 60% more nitrogen dioxide exposure than the national average. New study I was just looking at suggests that households making under $10,000 a year experience double the exposure to gas stove pollution compared to households making more than $150,000 a year. And that study goes on to say that to imply that race and income-based disparities are due in large part to differences in home size. We also can't forget to mention a new Harvard study that's come out about 2 months ago that talks about the fact that women are much more profoundly affected by all of this than men. The suggestion of that Harvard study is that women are still doing the lion's share of the cooking, so their exposure route, they're much closer to these off gases when they're coming out. So this is really affecting people of color. It's affecting low wealth individuals, affecting women, and we also know, to have straight talk about this, that in terms of looking at dollars spent on health care, a lot more money gets spent on men than on women in terms of looking at health care stuff. So this is, I think, a profoundly important bill in the communities that the caucus serves.
And as a state legislator, I always appreciate a bill that has zero fiscal impact for the state.
Mm-hmm.
But it actually, in my opinion, saves us money, because for those individuals who may have adverse health outcomes or asthma or respiratory illnesses, being educated about this danger of gas stoves can allow them to take precautions,
Yes.
which can save the state even more money through healthcare costs. So I appreciate that.
Yeah, and I think that, especially when you're talking about low wealth households, not having that outflow of money to deal with these terrible health inequities is the beginning of a pathway out of some of that economic despair. One other thing around asthma that doesn't get mentioned much is studies show that children with asthma have terrible absentee rates in schools. There's a new study out of the European Lung Association that shows children with asthma are much less likely to finish their studies. And we know that children with asthma are frequently bullied. They're seen as being different. So if you're talking about communities where you've got economic difficulty, the pathway of rising out of that difficulty through education is even narrowed by these health concerns which gas stoves create. So it's an important thing. You know, the other thing in terms of what you also brought up is that studies now show that the average American is one major health crisis away from poverty. And that's true. So I think that the notion of getting rid of the sources of these health issues, giving people the opportunity to make decisions, to make healthier choices, is incredibly, incredibly important.
It's safer homes means fewer ER visits for asthma, fewer cases of lead poisoning, fewer cases of burden on our healthcare system. This to me, this bill is about preventative care at really a housing level. So, I appreciate working on this piece of legislation, and I know that we've been, my staff, my team, and Senator Kruger's team have been diligently working to get this on bill to the finish line. So how has it been? I know you've been talking to a lot of members. Like, what's the reception?
So I will just say I have never worked on a bill where the ground game has been as robust as it is on this. So when you look at kind of the memoranda of support around this bill, the fire department, FASNY, supports the bill. Incredible support from the medical community, from the American Academy of Pediatrics, from Physicians for Social Responsibility, for the Union for Medical Interns, from faith-based organizations across the faith-based spectrum, from environmental justice groups like We Act for Environmental Justice and Push Buffalo and South Bronx Unite, and of course from environmental groups as well. There is a ground game on this thing where we are showing up at churches and bowling leagues and anybody who'll have us to talk about this to really create public foundation of support. The legislators themselves are really responsive. I think we're up at 47 or 48 folks in the assembly, and I think we're 8 people in the Senate away from assuring that we have a majority floor vote in that house. So it's moving really well because, as you say, this is common sense legislation with zero fiscal implication for the state that's going to help prevent human misery and provide pathways to health for people. What's the downside?
To me, having consumers empowered, it allows us to really have a conversation and be educated. So, we label cigarettes, cleaning products. We're transparent. Where we excuse me, we should be transparent when it comes to appliances that affect the air we breathe every day. And
Absolutely.
with this, we were able to pass this through the Assembly Consumer Protection Committee, which is very exciting.
Yep. And
And go ahead.
I just was going to jump in. You know, there's a really great chef that we work with named Chef Christopher Galarza, and we've been actually putting together a sign-on list of chefs because, many people think the only way to cook is with gas, and fine cooking is all about gas. And in fact, the big cooking competitions now are all done on these electric induction stoves, which I had no idea until I got into this. But
Really?
yeah.
I would think it would be gas.
I know, and I think that's partly because, Chef Ramsay has competitions, and I think the directors of photography of those TV shows think the gas stoves look good on camera, and they do. It's nice to have those big flames for camera, but no, they're on electric induction stoves, all of the big cooking competitions. But Chef Galarza over and over says, if you have anybody wanting to restrict public knowledge about things, you should be questioning a motive. So I think that that's a valuable consideration with anybody who wouldn't support this bill.
And so, how would you recommend that the everyday person get involved in this advocacy?
Sure. So first of all, you can look at the bill. You can go to New York A73 2025 or New York S1280 2025, and you can actually see the bill. Please contact your elected representatives. Tell them that you support the bill. But I was talking about the ground game. If you are part of a synagogue or a church or a bowling league or anything like that, and you would like somebody to talk to you, I don't know if this is cool, but I'm going to say it because you can edit it out later if it's not. But if you reach out to Assemblymember Solage's office, she will put you in touch with me, and we will get somebody to you because we want the communities to understand exactly what's going on.
And it's a good. I'm cool with you giving out my information because it's important that we have a discussion and that we educate members on this as we wait for this piece of legislation to pass, because people should know what indoor air pollutants exist. And so, go ahead, Tim. Go.
Yeah, no, just to put an exclamation point on that, the EPA now says that on average Americans spend 90% of our time indoors. Certain populations, very young people, very old people, people with cardiovascular issues, people with respiratory issues, spend even more than that 90% of time indoors. Those are the very populations of people who are most at risk from bad indoor air quality. The EPA does not have congressional authority to regulate indoor air quality. So we have a problem, and it can only be solved at the state level, which is why it's so exciting that New York, Illinois, Colorado, California are all looking at similar legislation around this. In Washington, D.C., there's a fascinating thing happening. In the district, there's a lawsuit against some appliance manufacturers, and the lawsuit alleges that they have known about indoor air quality issues affecting human health for a really long time and have kept quiet about it, much like the cigarette manufacturers did with cigarettes. But where in the cigarette lawsuits, they were trying to get their hands on a lot of money, what these folks are doing is simply trying to force the manufacturers in the District of Columbia to put warning labels on the gas stoves there. They see uplifting education as being the most important piece of this. So we're seeing this around the country. It can only happen at the state level, which is why I'm so thrilled that folks like you, Assembly Member, and Senator Krueger are in public service to bring awareness to the public. I can't thank you enough.
And I really look forward to not only debating this bill, but getting it signed by the governor, because our listeners should be educated on indoor air quality. So if you could leave our listeners with one takeaway about the air in their homes, what would it be?
You have the power to make healthier decisions. Let me also just quickly say, if you are in a home and you have a gas stove and you're not in a position to replace that stove right away, or you're in a rental situation, there are some things you can do. You can open a door or a window. The head of Physicians for Social Responsibility even suggests if you're cooking and you have multiple burners, use the burners furthest away from you to cook on. If you have a vent, run the vent. Studies show people only use the vents about 50% of the time. They don't like the noise and things like that. The thing about all of this information, though, is nobody is going to do any of these things unless they recognize that there's a danger from gas stoves. And putting warning labels on gas stoves is going to initiate that incredibly important conversation that will save lives. So I just thank the listeners for taking a moment to consider this, and of course thank the caucus so much, and was so thankful to see the caucus prioritize this bill last year, and I look forward to listening you debate it on the floor.
Oh, thank you, Tim. We're really at a moment where public health, climate, and consumer rights intersect, and this bill reflects that. It's about transparency, equity, and a cleaner home. So I'm excited to continue work, and I tell everyone, be engaged.
Thank you.
This wraps up this episode of the BPHA Caucus Podcast. Thank you for tuning in. and continuing the conversation on policy and issues that impact our communities. Stay connected with the BPH Caucus by following us on social media and visiting our website for updates on our legislative work and upcoming events. If you found today's conversation valuable, be sure to share this episode and subscribe so you never miss an update. Until next time, let's keep pushing for progress and equity for all New Yorkers. Thank you for listening.